The new CDC report revealing fetal and early infant deaths in the United States from 2020 to 2021 were still almost twice as high in babies born to black women compared to those born in white and Hispanic women. ABC News medical correspondent Dr. Darien Sutton is here to break it all down for us. Dr. Sutton, good morning to you. Good morning. It's great to have you. I know you've been covering this and looking at this for a while. Why does this disparity still exist?
You know, it's concerning, but it shouldn't be surprising. When we've seen prior in the studies and the results in terms of infant mortality, and in this case, perinatal mortality, which is when you have an infant or fetal death weeks before delivery or weeks after delivery, among black women, it remains high. The reasons why these numbers haven't changed mainly is because our healthcare systems and structures have not responded to these concerning numbers. And as far as the reasons overall why you can see this, there's a variety of reasons. Number one, access. We're seeing an increased rate of maternity care deserts. That's quantified or qualified as a county that doesn't have access to an OB or an obstetrician. 1/3 of our counties in this country do not have access to an OB or an obstetrician. And many people believe that that's mainly rural. And while that's partly correct, as 60% of maternity care deserts are rural, 40% are in the inner city. Also, in terms of healthcare coverage, we have approximately 8 million women in this country of reproductive age that do not have healthcare insurance. And that translates to no access to primary care, increased rates of untreated high blood pressure, diabetes, which create poor outcomes in terms of health. And then overall, when you look at black women who have health access, who have healthcare coverage and high levels of education, they still have disproportionately higher rates of poor outcomes compared to their white counterparts. And the reasoning behind that is discrimination, bias, and racism that translates as black women not being heard in terms of expressing their concerns during their pregnancy.
Just unbelievable. What's it going to take to see a difference here?
I think personally there is a variety of things that we can do today to change this. Number one, in our policy in terms of access, fixing these maternity care deserts by funding and expanding midwife care. That is one of the ways that we can help provide access to those in need. Expanding Medicaid. In states that have expanded Medicaid, we see improved outcomes among black women. Also, education of healthcare systems, healthcare providers in terms of the harmful effects of bias and discrimination. And then also requiring hospitals to be transparent about the results so that patients can make informed decisions. And then also we can hold hospitals accountable to who's doing bad and how we can correct that.
Is there something specific or are there symptoms specific that women and their partners can be looking out for, and how can they be their own health advocate, because we hear that so often?
I think it's so important. Number one, I think it's always important to bring an advocate with you. I think it's really important when I walk into a room and I'm talking to a patient, I find comfort when there's someone else there, because often when you're sitting in that patient garb and that gown, it's difficult to hear what you need to hear, but also making sure that you understand the symptoms of bleeding, pain, headache, swelling of your hands or your face. These are all concerning symptoms during pregnancy that should be addressed.
Need to know when it doesn't feel normal. It probably isn't. Dr.
Exactly.
Sutton, thank you as always for shedding your insights. We appreciate you.
Of course.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.